Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department and your host for today's Public Health Matters. It's the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today we are going to talk about health literacy and why it is important for everyone. According to the National Assessment of Adult Literacy, about 12% of the population are proficient in health literacy. This means that 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. Joining me to talk about this topic are Vicki Bands from University of Maryland, Upper Chesapeake, Community Outreach and Health Improvement, and Mary Ann Williams from the University of Maryland, Baltimore Health Sciences and Human Services Library. Welcome to our show and thank you so much for being here today.
Thanks for having us.
Sure. So let's start off, if you want to just introduce yourselves and tell us a little bit about how your role pertains to health literacy. Mary Ann, do you want to start?
Sure, I'll be glad to start. So as you mentioned, I work at the Health Sciences and Human Services Library at the University of Maryland, where I'm a medical librarian. And my responsibilities related to health literacy actually deal with teaching some workshops to faculty, staff, and students, again, related to health literacy, clear health communication, and to some extent, cultural competency. In addition, I'm on the steering committee for the Health Literacy Maryland, and more locally, I am chair of the health ministry team at St. Margaret's Parish here in Bel Air.
Very nice, keeps you busy.
Yes.
And I'm Vicki Bands. I'm the Director of Community Outreach and Health Improvement for University of Maryland, Upper Chesapeake. And we're out in the community, or I'm in the community, 5, 6, 7 days a week, working with everyone really in the community, lots of specific groups, some special groups. And so it's important for us, we're out there giving, educating, giving health information, screening people to see whether or not that they need to follow up with their provider, if they have any disease process going on. So we're constantly out in the community and dealing with everyone. So health literacy is a really important issue for us. We want to make sure that the information, the education, and what we're doing out there, people are understanding and get what they need to do and how they should be following up. So,
and can we define exactly what health literacy is?
Right, so kind of based on a little bit of what Vicki just said, health literacy is basically the ability of a patient to be able to obtain information, process information, and understand information, both health information and also the healthcare system and the healthcare services that are available to them.
Why does it affect people and how is it important?
Do you want to start with that?
Sure.
Okay.
It really does, like you had said earlier, 9 out of 10, we estimate 9 out of 10 people are health illiterate at some point in time during their medical career, if you will, in the sense of dealing with their doctors. And it significantly affects people if they don't understand their care or their treatment or how important it is for them to follow a particular treatment or care. We'll see these folks back in the emergency room frequently. We'll see them be admitted to the hospital. We'll see them have terrible effects from their disease that had they had a better understanding of their disease process and what they needed to do to stay healthy, may not have these complications. And bottom line, could potentially even live longer if they were able to understand and do what they needed to do.
Especially if it was if they had many directions leaving their doctor instead of just one direction, could be a little bit more challenging to understand.
Absolutely.
Their health that way.
Right, and just even trying to know what are all the options that one has for health services. and the accessibility of those services, in addition to just the health understanding and, as you had mentioned.
Right. And then how would you even know what would be available if you weren't really sure, if you weren't health literate? Does that bring us to the Patient Bill of Rights? We wanted to talk a little bit about that.
Yes. Okay. So the Patient Bill of Rights, the one thing that I like about that is I feel it empowers the patients to ask questions. This way, most hospitals, most doctors' offices will have a Patient Bill of Rights. It may be posted, it may be a handout that's available in the clinic or at the hospital. And embedded within that is your right as a patient to request information that you can understand. So if you're not getting it, you need to ask for that, and you have the right to do that. And I think that's one of the most important points about it.
You'll hear people talk about plain language. That in that Bill of Rights, people are, they request, not only request, but they have the right to have information that they understand. And when we say plain language, that means language that they can understand, language that is clear to them. And so, just like Marianne said, they have the right to ask for that if they're not receiving that.
And in addition to that, if you speak another language, you also have the right to request for an interpreter, someone to help you, help you and also help the healthcare provider translate that information correctly back and forth. And if you are deaf or hard of hearing, you're also entitled to have a sign language interpreter there. So those are things that people may not realize.
Okay, that's great to be able to ask for that. Even, what would you say if somebody, talk about 9 out of 10 people really struggle with understanding doctors' orders, what would you say if somebody just felt silly? I mean, you don't think that many people really have a hard time understanding all the time, but going in there with all these questions and then just kind of feeling silly for even asking those questions.
I don't know if they feel so much silly. I think what we see, a lot of people feel like clinicians are really very smart people, and they know so much more than what I know. And I am embarrassed to let them know that I'm not as smart as them and that I should be asking these questions. So I think it's a couple things where, they lack the confidence to say something. They feel embarrassed because they don't feel like they're smart enough. And so that really does impact them getting the information that they really need in order to manage themselves successfully.
Right.
Yeah, and just feeling intimidated by the whole healthcare process and the setting that they're in.
Right. Yeah, because I'll go to the doctor, and I sometimes am not 100% clear. I mean, I get the gist, but not 100% clear, and then I just feel either embarrassed or just kind of like, I should know this information, and I don't, and really just how to bring it up to the doctor to make sure that you're getting the right information.
And there is some responsibility on the part of the physician or the nurse to pick up some of that as well.
Right.
But again, you do have the right, to ask questions. And if that physician can't answer it, or they're short on time, because we know they can't always spend a lot of time, you can ask for a nurse to explain it. You can ask for a patient advocate or an ombudsman to help you, or a social worker, depending on what you're trying to navigate.
Right.
So again, I think the patient rights is helpful just so that people know that they can be empowered to ask those questions. And there really is no silly question.
Right, right.
And that's our, out in the community, that's part of what we want to make sure that we're impressing upon people, that you do have the right to ask that question. Don't ever feel like a question is silly or stupid or whatever. This is your life we're talking about. This is your health. So you have every right, and it's important that you get your questions answered.
Right. Who do you think, who's more likely to experience health literacy?
Well, while there are certain groups that typically are defined as some people who have low educational level, maybe a low income, maybe minorities or ethnic groups, maybe immigrants, as we see a lot of immigrants coming into the country. But as we were discussing earlier, that's really not the case. And do you want to continue on that?
Yeah, sure. When we say 9 out of 10, it could possibly be 10 out of 10 people at some point in time. There's lots of cultural, certainly, and understanding the language and that kind of thing certainly does play a part. But just simply not feeling well, being sick, being overwhelmed with the information that you're getting, being under a lot of stress with regards to your disease process, all of those kinds of things impact what you're hearing and processing and understanding when you're talking to the medical profession. So it could be anybody. I always use the example that, I think I'm a pretty smart person. I'm in the medical field for, like 40 years. I should know this stuff, right? I get my insurance, my bill from the insurance company, and I'm like, it's all over. Sometimes it's like, geez, I really need to sit down and look at this. So when you think about that, it's anybody that there are certain pieces of information or time where people will not be ready to hear the information or understand the information.
Yeah. The other thing I also think is that health professionals are so used to using their language that they kind of toss that out. So even if you are a literate person and maybe you've graduated from high school, college, there may be terminology you don't understand. And again, the health professional, so used to talking to people on their own level, may forget that you may not understand that. So again, you do need to, you do need to ask.
Yeah,
Right.
Yeah, and that's right. I think our terminology that we use, and sometimes you'll have a conversation with a healthcare provider, and they feel like if they use plain language, as we say, that they'll think their patients will think that they're talking down to them, that they're supposed to use these high technical terms, and that's really not the case by any means. So that does impact people's ability to ask questions or feel comfortable asking questions as well. You sort of get in the habit of start explaining things. People, it's not that they can't ever learn or understand what the terminology is. It's just a matter they need to hear it and have it explained to them numerous times. So, for example, we always talk about go see your PCP or your primary care doctor. I will tell you that 9 out of 10 people don't understand what a PCP or a primary care doc is. So when you're explaining to them, it's not to don't ever use that term. It's a matter of saying, we'd like you, we think it's important that you see your PCP or your primary care doc. The doc, like your family doc, like the doc that you see for like if you had flu or you have high blood pressure or something like that. The doc that you see all the time. So they start, when you explain it like that and they hear that numerous times, well, maybe by the 4th or 5th, 6th time, they begin to understand, oh, PCP, oh yeah, that's my family doc, I got it, So it's not that we don't want to educate them along the way, it's just that we have to be really clear and make sure they do understand what we're telling them.
Right. You talking about your insurance bill, really quickly to go back to that, but really, they're kind of hard to understand, and then if there's a discrepancy and you can't understand, you would never know, you'd think that you'd have to pay, this amount of money, and then, you're really out that when there was a discrepancy and your insurance should have covered that to begin with or something like that. So even just calling after the fact.
Right, and having it checked.
Yeah, exactly. And sometimes you get your form and it doesn't really even say what the charge is for, or it has a code that you don't understand.
Right.
So again, you can call for, usually there's a phone number for billing information, or call your physician, physician's office.
Right. I just thought that was a good point. We didn't talk about that.
Yeah.
Is health literacy just associated with words, or is numeracy involved as well?
No, health literacy definitely, it's sort of, I think of health literacy as the overarching topic, but numeracy, which means your ability to understand simple math and be able to figure out a problem, is critical for managing your health. When you think about everybody, most times people go to the doctors, they come out with a medication, whether they take it every single day or whether they're just sick for this period of time and they have to take it for a week or two. Medication is really where you see numeracy come in, because they'll be the instructions are not easy for them to understand many times. So for example, if they had to take a medication twice a day, and the medication says you take it twice a day, first of all, they have to figure out what does that mean. Is it 10 o'clock in the morning and then 12 o'clock again, or you have to explain to them twice a day means that it's 12 hours apart. So it's 8 and 8, or 7 and 7, or 6 and, those kinds of things. But then if the instructions go farther and say you need to take this medication 2 hours before a meal or 1 hour after a meal, now that's a whole nother ballgame, because now you have to say, okay, Mrs. Mraz, you have a medication here. You're going to eat breakfast at 9 o'clock, and you have to take this medicine in the morning. When would you take this medicine? If you're going to take it 2 hours before, what time is that? If you're going to take it an hour after, what time is that? So then, you have to take it a second time. So tell me, when would you take it 2 hours before or 1 hour after? So there are these simple addition and subtraction sort of math skills that people have to understand. And I think, we're so worried about the words that numeracy sometimes gets shoved to the side. But as you can see clearly, an important thing for them to understand.
Right. And since we're talking about, what patients can do, or we'll be talking a little bit more later, again, if your doctor doesn't explain it well, again, you should ask and say, does this mean I should take it at 9 o'clock? Does this mean I should take it at a particular time? You also have a pharmacist, your local pharmacists, who are extremely knowledgeable. So you can also go and double check with them as well. And in terms of numeracy, some other areas that we might see questions about is in terms of risk. Your doctor will tell you your risk factor for a particular condition, or the results of a surgery, or even the probability of something becoming cancerous or whatever. So those are numbers that sometimes doctors will say, 62 million people. Well, I have a hard time knowing and imagining 62 million people, but I might understand 1 out of 10 persons might have something. So again, just ask them to explain it in a slightly different way.
Right, like break it down for me.
Right, break it down for me, yeah.
Okay, what's the average reading level, and why is this relevant? Why do we care about this?
Okay, so some studies have indicated that the average reading level for adults is 8th grade. What's very interesting in terms of health literacy is that most of the information, pamphlets, even websites, instructional materials are written for people at a 10th grade level or above. So right now we have a really big disconnect. The National Institutes of Health, NIH, recommends that patient information be written at a 6th grade level, and fairly recently the Joint Commission on Hospitals now recommends a 5th grade level. So that's telling us that even 8th grade might be a little bit too high. And there really is that issue with making it so simple that you leave out what you think are key points. So there is always that tug of war in writing pamphlets and materials that are at a lower level. There are some resources which actually will provide basic information, and then if your audience can handle materials that are a higher literacy level, they also have like beyond the basics as well. So that is also a possibility.
Okay. Do you have anything to add?
No, we typically are very cognizant of that, and when we develop educational materials, we really try to stick to the 6th grade or lower, and any kind of instructions, that kind of thing. And we try to pass that on to everybody we possibly can that are going to be doing or giving any information or instructions to patients. So,
let's talk about the internet and how that can really mislead and give false information. Do you have any suggestions? Okay. For people?
Right, and so the internet, we're also talking about social media now, and there's so much out there. So yeah, there are quite a few things that patients can do or folks can do. First of all, I would say try to go to a reputable site. So anything produced by the government, so it would be .gov, is usually a good place to start. NIH and all of the branches of NIH have a lot of materials that are available. Many educational institutions, so they be .edu, are also good places to go. Many hospitals are organizations, considered organizations. So some of the major hospitals, again, if it has .org, would be a good place, as well as many of the major associations. You do have to be a little careful with organizations because there are a lot of organizations out there that may not be quite as reputable as the ones that we've just talked about. So then you would really need to look at the About Us. Find out who is creating that website, who are the editorial boards for those websites. Look to see if there are any advertisements. If they're highlighting, say, a particular drug, then it's a chance that the information is going to be a little biased towards whatever drug company and their products. So you do need to be careful about that as well. And there are other ways. We'll talk a little bit later about Medline Plus, and there is a section in there related to evaluating health information that has both information as well as tutorials.
We can just jump into the resources available that we were discussing earlier. There was a booklet, if you wanted to talk a little bit about that one.
Okay, so there's several things. There's one that is a guide. It says for older persons, talking with your doctor, but honestly, as we were talking earlier, it's really good for any adult. It has a lot of good information about how to be prepared to go to your physician's visit, and just general information that you might need to have, just in terms of navigating the healthcare system, et cetera. There's another really good information sheet, which I think you'll have a display on, which is the Ask Me 3, which patients can bring to their office, bring to their visit, reminds them to ask what is their problem, what can be done, and also better understanding why I need to do this particular procedure. You might also ask, are there any alternatives as well, which is not on there, but maybe something else you might want to ask. Right. I'll just also mention Medline Plus, which is a resource available from the National Library of Medicine. It links to many resources, so everything there is vetted information, good quality information. There's also a section on health literacy, and also within that there's a little link to patients talking with their physicians and some key points to keep in mind, evaluating health information, and patient rights, your rights as a patient. So those are all available through that Medline Plus, which also has, again, health information, information on drugs, as well as videos. So a patient could even look up to see if they're having a procedure, maybe get a little idea as to what that procedure is all about.
Okay. What about improving, we talked about this a little earlier about how patients can improve their health literacy, but really it's the other way around.
Yeah. If you have somebody that's an adult and they are at this particular literacy level, the chances of being able to increase their literacy level is probably not great. So the onus is really on the clinician to make sure that they, the clinician, are giving the information in a way that person is able to understand that. We educate physicians and clinicians to do sort of what we call a teach-back method. So when they give information to the patient and they say, I want you to do this, for example, I need you to take this medicine twice a day, you'll need to take it before meals, blah, 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 and explain to them. Then to say to the patient, Mrs. Mraz, could you tell me what I just told you? Could you explain to me how you're going to take this medicine? So it requires the patient then to report back or repeat back to the physician or the clinician that this is how they're going to take that medicine. This is what they think how they should be taking it. So then the physician or clinician has a much better idea of whether that patient really understands what they just had to say. So that's an important method. We also encourage patients to take someone else with them. A second set of ears is invaluable, especially if they're receiving a diagnosis or some information that's difficult to hear, or it definitely could use a second pair of ears. That may not always be possible, so we encourage people to have their questions written down. They can either hand that list to the physician so that they know right off the bat what they need to have answered that day, or they can ask those questions to the doctor themselves. We also encourage them to bring a pad of paper and pencil so that they can write down the information, or they can ask the doctor to write the information for them. So there are ways to help them be more be able to understand, more prepared.
Yeah.
Right. That was going to be my next question. But it's funny about the pen and paper. So many times I know in my head what I'm going to ask the doctor, and then when it actually comes down to it, I'm getting in my car and I'm like, oh, I forgot to ask this.
Oh yeah, but if you had it written down, you can kind of look through and say, oh, I forgot to ask this. Before you go out of the door, let me ask you this question, or ask the nurse.
Right.
You get in conversations with the providers, and it's easy for things to slip your mind.
Right.
So.
Okay, this one's kind of a long question, so I'm going to read this. But research argues that people with low health literacy are more likely to visit the emergency room, they have more hospital stays, and they're less likely to follow up with treatments, and they have higher mortality rates. What are some things that doctors or even health educators can do to explain summaries of their visits to the patients? So we kind of already talked about this, but we have about a couple minutes left if you want to just briefly talk about that.
Well, it is true. That's for sure. Those facts are clear.
Yes.
And there's a couple reasons. A patient never typically doesn't go in and with the idea of saying, I'm not going to do what they tell me to do. They go in because they're being proactive about their care. They want to hear what's wrong. So when we talk about the Ask 3, what is wrong with me? What do I need to do about it? And why is it important that I do this? And I think that last one, why is it important, is really important, because patients, if they don't feel the treatment or what the doctor is telling them is of value to them, that this really doesn't make a difference one way or another to them, they really have to be clear and understand that what they're asking them to do is important for their health and their well-being. And so once a patient values the treatment or values what the physician is saying to them, they're more likely or be much more willing to follow the instructions and try to be, I hate the word, that they're not compliant, because that's not a great word, but that just helps them be more successful in their treatment. So they really have to buy into it as well. And to get them to buy into it, they have to have a clear understanding of why. So I think that's an important piece.
I think so too, and I think another piece would be, especially when it comes to medication, some are so expensive. If you can't afford it, I think you need to be honest with your provider and ask if there are resources to help pay for.
Right. Speak up. That's today's message, right?
Yes.
Don't be afraid to speak up if you don't understand something or need something explained a little bit better.
Yep.
Well, that flew by. So we are out of time. So we could pick this back up later or close today, but the main message is just speak up, right? Ask questions.
Right, you need to be an advocate for yourself or for your family member.
Make sure you understand.
Okay.
And be prepared.
Yes. Well, that is all we have time for today. I would like to thank my guests on today's show, Vicki Bands and Marianne Williams. If you would like more information on health literacy, please refer to the resource page after this program. Join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.